Good day. I'm Dr. Chanel Concepcion, and we will be discussing sampling and quantitative research today as part of the lecture series in nursing research. At the outset, we have to establish that sampling matters. So this is a story of a presidential election poll which highlights the importance of doing sampling the right way. The newspaper Chicago Tribune conducted a poll that projected Dewey's win over Truman in an American presidential election. However, the actual result was that Truman won the presidential election by a wide margin. And why did this happen? This was a classic example of what we call a sampling bias. They discovered that the poll oversampled Republicans in their data for a pretty simple reason. They used telephone calls to collect their data. And at that time, wealthy people were most likely Republicans, and they're most likely owners of telephones. So that skewed the poll significantly towards Dewey. So the takeaway there is that it is not just what you ask and how you ask it, but who you're asking. So getting a solid understanding of sampling is very important for any researcher. So what we're going to talk about today are sampling concepts, the two types of sampling design, which is non-probability and probability sampling size, especially in quantitative research, and sampling plan. So let's get into some of the concepts that are very important to understand sampling. So first, let's define what sampling is. So it is the process of selecting a portion of the population, which is an entire aggregator, entire collection of cases for a research study that you are making. If you look at a certain research article, you can find it in the methods or methodology section. And if you're doing a research proposal, it will have to be in chapter 3, which is usually the methodology portion of your research proposal. So when we talk about population, this is the entire aggregation or your entire cases in which a researcher is interested in. For example, you are so interested to study Filipino nurses with doctorate degrees. So if you think about your population, this would all be the Filipino citizens who are registered nurses and with a doctorate degree such as a PhD or a doctor of nursing science or any doctoral level degree. So this is your population. The accessible population is that portion of the population to which the researcher has reasonable access. You can't possibly get all the, let's say, Filipino nurses that have PhD or they have doctorate level degrees, but there are some maybe in a certain city, a certain region, or a certain school where you have reasonable access. Okay, so this is a subset of the target population, which is your accessible population. The target population is the aggregate of cases about which the researcher would like to generalize. So if you look at it, this is the general population, of course, maybe all the nurses, but your target population here are the nurses with a doctorate level degree or a PhD, a DNS, or any doctorate level degree. Now, you can, like I said, we can't possibly get everybody to join your study, so maybe you have access to the regional nurses who have doctorate degree or all that are members of kind of a dean's conference or educational association. So that's your accessible population. Then your sample are the people who would be included in your study. So what is a sample? It is a subset of the population elements, which are most basic unit about which the data are collected. So there are two main considerations when you're doing a sample for a quantitative study. First is representativeness, and the other is sample size, which we will discuss later. So representativeness. So this is one whose key characteristic closely approximate those of the population. So if you can see here, this will be our population. So, and then if you look at sample A, this is not a representative of that population. But if you look at sample B, probably the same because it excludes some members of the population. And sample C here should be a representative because every subset in the population is represented. Now your sampling designs. There are two main sampling designs. One is probability sampling and the other one is non-probability. So when you talk about probability, this is the random selection of elements and it has greater confidence in the representativeness of your sample, especially in quantitative research. This is a very important element. Non-probability, it doesn't mean it's inferior, it's just that in quantitative research, this is probably weaker in terms of design compared to probability sampling design. So the non-probability, the elements are not selected through random methods. Now strata. Strata just means subpopulation. So for example, this is your population and this is your strata. Okay, that's you're trying to group them into different subgroups, and then your samples are the ones that are included in your study. So this is just another way to another example. So this is, for example, you have a list of clients here, and you want to stratify it according to their ethnicity. For example, Caucasians, African Americans, Hispanic Americans, and you do a random sampling or certain sampling within each stratification or each of the subgroups. A stage sampling is a multi-stage sample. So the samples are sometimes selected in different or more than one phases. For example, you are in a country level, you randomize, and then you go to the segments, and then you randomize again, then to the household, and then you go to the individuals. So the sampling happens in different levels. So this is what you call staged sampling or multi-staged sampling. We talked about earlier about sampling bias. So this is a systematic over-representation, or it could be an under-representation of a population subgroup on a characteristic relevant to the research question. So if you look at this portion here, you have a good representative, which is your sample, but here you have a little bit of bias. It could be over-representation or under-representation, just like the example on the American presidential election where they over-represented the Republicans, causing the poll to be skewed to one candidate instead of the actual person who won. So eligibility criteria is when you have a research study, especially in quantitative research, you have to make sure you are very clear about who the people you should be including in your study. So most of the people would state their inclusion criteria, the way it would make very clear what are the specific characteristics of people in your study. Or sometimes others would also put what are the exclusion criteria. For example, if they have underlying disease, then you exclude that person in your selection. So those characteristics that are not, that those who are members of or the people that are in your sample should not possess. So there are so many considerations when talk about this criteria or inclusion criteria. The cost, the practical constraints, the ability to participate in the design. So now we'll talk about non-probability sampling. So these design of sampling are less likely compared to probability sampling to produce more representative samples. So these are the types of non-probability sampling: convenience sampling, quota sampling, and consecutive sampling, and also purposive sampling. So let's look into each of these non-probability sampling designs. So convenience sampling. So just like the term convenience, this is used for those people who are available as participants. So participants may be atypical of the population. For example, you want to do a survey, so you just stand outside the store, for example, and give out the survey form. So whoever is closest to you or whoever has accessible population, you just give the sample. It's very convenient for you. It's very practical, however, it is subjected to bias. So this is an example here where they studied the variations in the barriers to compassion across healthcare disciplines in New Zealand. So the researchers recruited a convenient sample, about 1,700 nurses. That's a good number of nurses and physicians and medical students, but they did not do any random sampling. Whoever answers their questionnaires probably were included in their sample. Snowballing is a type of convenience sampling, but usually snowballing technique is used when it's very difficult to recruit participants or respondents in your study. So it's also called network sampling or chain sampling. So participants are asked here to refer to other people who meet the inclusion criteria. So for example, you are looking for patients who have cystic fibrosis, those with difficult diagnosis, difficult to recruit. So you would probably ask one person, and maybe that person is part of a support group. So you would ask, can you refer another patient whom I can interview or who can answer my questionnaire? So it's like a snowball. It starts very small, and the more people refer participants or respondents to you, the bigger the sample becomes. So quota sampling. Quota sampling here is the research identifies population strata and determines how many participants are needed in each stratum. So for example, here you have a population of 1,500 elderly living in a residential setting. So your population, usually there's 1,000 females and 500 males. So in your quota sampling, you will determine I would need about 10%, which is maybe 100 females and maybe 50 males for, so it could be proportional or it could be disproportional. So this is also another example of quota sampling where they studied a relationship between smoking in the home and lung cancer, worry, and perceived risk. So they recruited a sample of 515 homeowners in Kentucky, and they used quota sampling to ensure that half of the samples had smokers and also half did not. The other one is consecutive sampling. So recruiting all the people from an accessible population who meet the eligibility criteria over a specified time interval or for a specific sample size. So maybe you're very lucky, you can have everybody, for example, in a clinic, all the patients in a clinic to come and be part of the sample. So you call it consecutive sampling. So for example, in this example here, they studied pain and its effects on functional ability of children treated for cancer. So they were able to recruit a consecutive sample of 62 children being treated at the Children's Cancer Center in Lebanon. Purposive sampling. So purposive sampling is kind of similar to convenience sampling, but here the researcher uses the knowledge about the population to make a decision on who to select as part of the study. So usually the researcher would select people who are knowledgeable about the issue that they're studying. For example, there is a Delphi study on nurse experts to identify essential competencies in American nursing education for prevention and care related to unintended pregnancy. So what the researcher did was to select 100 panelists who are experts in this subject matter from across 50 states in the United States. So you're looking for certain experts or knowledgeable people about this subject matter. So it's more intentional compared to your convenience sampling. So the evaluation of non-probability sampling. So of course it is not representative of the population. And of course you're prone to bias. It could be misleading if you make conclusions out from it, misguided efforts to generalize to a broader population. But it does not mean that non-probability sampling is not legitimate or is not valid. It's still very predominant in many of the researches because it's very practical. But you have to be very conscious about making inferences. And you have to make an effort to enhance representativeness, for example, using quota sampling. So let's look at probability sampling. So probability sampling involves random sampling of the population. So let's talk about probability sampling. There are four main types of probability sampling, including simple random sampling, stratified random, multi-stage cluster sampling, and also systematic sampling. So the simple random sampling, this is the most basic probability sampling. So you need to start with a sampling frame. So usually these are the list of people within your accessible population or target population, a list of the elements from which the sample will be randomly chosen. So for example, in this study, they studied the relationship between perceptions of nurse managers, transformational leadership behavior on one hand, and the nurse's job satisfaction and patient safety outcomes on the other. So they're looking at random sampling of 378 acute care nurses in Ontario. And usually what we do here in random sampling is we have to make sure there's a sampling frame. For example, you're looking at all the nurses in Ontario, so you list down all of these nurses and all of the people in the sampling frame. Usually we would put numbers in it, and then we would choose. Usually the modern way of choosing is using Excel. There is a random function in Excel where you can randomly choose who will be in your sample, or you can use table of random numbers, but that's a little bit of old way. Don't use the fishbowl method because that's a very, very old-fashioned way. There are a lot of techniques now and apps that you could use, and Excel is always there to use for you to use in order to choose randomly from your sampling frame. Stratified random sampling, the population is first divided into two groups or more homogeneous strata. That means they're almost the same, maybe based on gender or age or ethnicity, from which elements are selected at random. So for example, this example here, they sought to describe school nursing workforce, and they used survey data from 1,062 public schools in the United States. The sample of schools were selected using a stratified random design with stratification. The way they divided their stratification, or the way they divided their respondents or participants, is through region, urban or rural status, and also school level. So they divided them into different groups and then did the random sampling from there. Multi-stage or cluster sampling involves selecting broad groups, bigger clusters, rather than selecting individuals at the first stage of the multi-stage approach. So for example, in this study, they started out as a district, so they listed all the district, and then they randomly selected which district. From that, they determine what are the health centers in that district that were selected, and they randomly sampled again, and then they sampled which women will be included as a sample in their study. So there are different stages before they come up with the people who will be included in the study. So systematic sampling involves selecting every case from a list, such as every 10th person on a patient list or every 25th in a student roster. So for example, here in this illustration here, you're looking at every third person will be included in the sample. Okay, so this is usually the formula used. So for example, this is the total accessible population, and this is the sample size you wanted to do. So your interval would be around every 200th person. So there's a systematic way to determine the people in your sample. So evaluation of probability sampling, of course, when you talk about quantitative research, it's concerned with representativeness so that you can make generalization in the target population. So this is the best method of obtaining representativeness. So you're able to establish magnitude of sampling error. You can compute sampling error, but the disadvantage is it's rather impractical. Randomization is quite a challenge, and it's very difficult to do and sometimes even impossible. So we have to be careful and be aware of sampling errors. So this refers to the difference between sample values, that is the average age of the person in the sample, and the population values, the average age of a population. So there is a difference between sampling error and non-sampling error. So these are potential sources of error when you estimate the population distribution using a sample. If it's a sampling error, it's just because the sample is not the whole population, it's just part of the sampling error, and that is usually set when you present your data. The non-sampling error is due to a poor sampling method, okay, just like the presidential election between Dewey and Truman that we talked about, or it could be the questionnaire or the instrument. There's an error there, or some behavioral effects. So let's look into the sample size and quantitative studies. Now we have to understand that there is no simple formula to calculate the right sample size, okay? So the larger the sample, the more representative of the population. That's kind of the basic rule. Larger samples yield smaller sampling errors, but it's still no guarantee that if you have a larger sample size, it is accurate. So sometimes most researchers will look into previous studies about a similar topic and see what is the sample size that previous researchers used. Okay, so there are different factors that affect the sample size requirement in quantitative research. One is effect size. Power analysis builds on the concept of an effect size, which expresses the strength of the relationship among research variables. We don't have much time to read about power analysis or effect size, but you can look at your handouts to read more on that. But if there is a reason, the main important thing we have to know, if there's a reason to expect that, for example, your independent and dependent variables are strongly related, then a relatively small sample may be adequate to reveal the relationship statistically. So this involves statistical analysis. So typically, however, in nursing interventions, usually there's moderate effect. So when there is no a priori is a theoretical deduction reason for believing that the relationship is strong, then if you have a very sample size, it is quite risky, okay? So you also need to look at the homogeneity of the population. So the smaller sample size, if the population is relatively homogeneous, okay, or almost the same characteristic. The cooperation and attrition. So we have to know that when we are giving, for example, questionnaires, not 100% would respond. There is a certain response rate, for example, 50% or the like. Subgroup analysis also. Testing hypothesis in subgroups instead of the entire population could affect the sample size. So a while ago, we talked about power analysis. So in quantitative studies, researchers ideally should use a power analysis to estimate sample size needs. So we have to, like I said a while ago, that large sample size are preferred over small ones because large sample size enhances what you call statistical conclusion validity, and they tend to be more representative, right? But like I said, even a large sample size does not guarantee representativeness. Okay, so how do we calculate sample size? So like I said, there's no one straightforward way to calculate sample size, but in some literature, the Slovin's method is one that you could probably find, and this is the formula. There are also other standard formula using this formula, and then you just plug in some of the things that you like, for example, the margin of error, population size, and all of these variables here. If you go to the internet, there's also calculator net, which I usually like to do. You put your confidence interval, your margin of error, and your population proportion, so you can calculate your sample size. Now we'll talk about sampling plan. So these are some of the steps in quantitative research. First, you have to identify the population. What is your accessible population? And then we talked about how to specify your eligibility criteria, your inclusion or exclusion criteria. And then you have to specify your sampling plan. What is the sample size? Maybe you have to do power analysis. You have to decide whether it's probability or non-probability sampling. And then you recruit your sample. So this is a criteria guideline for critically appraising your quantitative sampling plans. I don't have to go through each of them, but you can read them in the 11th edition of Pullett and Beck. I think this is chapter 14 for more details. So that's all about sampling. If you have any questions, feel free to email me. Thank you very much.